Lori, can you tell us a little bit about sort of what that first encounter is like with a therapist, what patients might expect, how patients may want to prepare in advance for that?
I think, that's a great question because I think a lot of times one of the reasons I love being a health psychologist is that I can see patients that would otherwise never end up in psychotherapy, right? They're completely healthy copers and really don't need a lot of mental health care. But because they have this IBD, now they are, experiencing some symptoms and they need symptom management. So it is a very different patient population than what you would see like in a community mental health clinic. And so I think when we think about, seeing a therapist, seeing a counselor, you kind of picture this, doctor checking boxes. Are you depressed? Are you sad? What about panic attacks? Do you want to kill yourself? Those kinds of questions. But I would say that if you're seeing a health psychologist, which would be, as Mike mentioned, sort of the preferred method, really that person is trained to first really understand your physical symptoms. How often are you going to the bathroom? Are you having urgency? Are you canceling your social plans? Are you tired? What are you eating? They're going to really focus much like your gastroenterologist will, but in a much sort of, we have more time as psychologists to be able to get at some of this information. But probably a good chunk, 20, 30 minutes of that first visit is really understanding your disease. Whether you're anticipating a surgery, whether you're on prednisone, whether you're having any side effects or body image disturbances, really focused on your GI. And then what I often tell patients is after I've taken a really good GI history and an IBD history, then I ask them, put yourself in context. Tell me about yourself and how you relate to your disease. What were you like before you had this disease? Or, in our pediatric patients, what do you want to be when you grow up? How does this disease fit with the rest of your life? Does it fit with the rest of your life? And so my assessment from that perspective allows me to really walk away at the end with my goal being, I want to know, is this patient resilient? How can we get them more resilient? What are their strengths? What have they been doing thus far to cope, right? Because I realize that usually I'm not seeing somebody right at the point of their diagnosis. So they've done some amount of adjusting and coping, and now they're struggling for another reason. But really trying to put that into context. So I think, in that first hour that you're meeting with the therapist, I think patients really feel relieved when they leave because they've been able to tell their disease story and make connections between their physical body and their mind. And that's sort of the main goal when you see a health psychologist.
So both of you would recommend, if we are looking to seek mental health services, to find someone who has experience with IBD?
I strongly would.
Yeah. Or, if you can't find somebody that has experience with IBD, at least find somebody that is familiar with that's a health, that labels themselves a health psychologist, frankly. Even if IBD isn't their specialty, health psychologists are trained to know the overlap between physical and mental health. They're trained also to coordinate care with your medical provider. And I think that's something that a community mental health provider might not do, but most health psychologists are going to call your gastroenterologist and they're going to say, hey, I saw your patient. This is what I think's going on. What do you think? And that, I think that's really a critical skill that health psychologists have. Even if they're not an expert in IBD, they'll call your doctor and find out about your IBD.
Okay. So how can we find these resources as patients? Should we be relying on our gastroenterologist to refer us, or are there other ways we can find mental health resources that would benefit us?
I think a direct referral from either your gastroenterologist or your primary care doctor is always the best bet. And again, the ideal situation is that there's going to be some some back conversations and coordination of care. I think in many cases, patients will travel several hours to see their gastroenterologist because that's relatively infrequent. And if you are meeting with a therapist or a psychologist, having someone that is a little more close to home or local could be a huge advantage. And in that case, and again, we deal with this a lot in pediatrics, I will often refer a patient back to their local home primary care physician. I'll call their primary care physician and say, hey, these are my concerns. Is there a psychologist that you would recommend that you have a good relationship with, and sort of work that way as well? I don't know of any other sort of web-based resources to locate a good psychologist aside from sort of a direct referral from a gastroenterologist, but Lori may.
Yeah. No, I mean, I would also really stress trying to get a couple names from from doctors that you trust, right? Good doctors know good doctors. If your doctors have established a pathway with a therapist, I think that's always the best strategy. In psychiatry and in psychology, telehealth has become much more common. And so I think, a lot of therapists now, as long as they're in the state that you live in, are able to provide services over video. So a lot of times it will be like maybe you go in and meet with them once, but they might be an hour, 2 hours away. But because you're able to do telemedicine, it works out. So that's becoming less of a barrier. If you really get stuck, I think looking at the American Psychological Association or your state psychological association, so the New York Psychological Association, the Illinois, whatever, they usually have lists of members and providers, and you can filter search terms. You could search people who have expertise in chronic illness. People who do cognitive behavior therapy might be important, for example, which is really the best, most evidence-based treatment, psychological treatment for depression. And you could kind of do that. Sometimes, for people, it's insurance issues. And so, checking, sometimes if you call a care manager at your insurance, they'll be able, and you tell them what you're looking for, they'll at least be able to put you in touch. I would encourage patients, though, don't be afraid to interview a couple different therapists. Don't give up if it's not a good fit for whatever reason. It doesn't have to mean that the person's not qualified. It just might not be a good personality fit. Find someone else. You should feel comfortable. I often tell my patients, think of me as on retainer. I'm going to come in and out of your life because you have this long-term disease, and you might see me for a couple months while you're finishing up a flare, and then not see me again until you're pregnant and coming off medications. And so it's worth that initial investment, I think, to find a therapist that you like and you can work with and you feel comfortable with. And I would just encourage patients to not get discouraged if the first person they try doesn't work out. Don't throw the baby out with the bathwater.
So I want to thank both Mike and Laurie for being here today. And I want to thank the CCFA for hosting this webinar, as well as CCFA Partners for all the work they've done in studying depression and IBD. And please refer to either of these resources if you have any further questions. Thank you.